So, relative energy deficiency in sports, also known as red S, is when the body system does not have enough energy to support both our daily function needs as well as our training needs. So, when the body is being underfueled, it gets forced to go into basically survival mode where it has to determine what's going to be the most important thing that our body needs, shutting down or limiting some other systems. So things that end up, that can occur. It can affect our hormones. It can affect our menstruation, our bone health, our training, um, how well we're able to do in the sport, our recovery, and so much more. So, what causes red S? Red S is caused by low energy availability. This means when there's not enough energy left over for the body for exercise, um, and basically we're not eating enough to account for that exercise on top of our normal functions. And this can happen for several reasons. It could be an athlete is increasing their training volume, but not necessarily increasing their food intake. They might have a busy or long schedule practice that makes it hard to not eat enough. Nutrition information, like misinformation about weight or body composition, things like that, that we're not understanding and we're accidentally underfueling. It could be intentional dieting or pressure to lose weight. Also, eating disorders and disordered eating can play a role. I think it's important to know that red S is not necessarily always happening intentionally. Many athletes might simply underestimate how to fuel their bodies and how much they actually need. So, so who's at risk for red S? Truly, anyone that is doing activity can be at risk for red S. However, different sports that value things like aesthetics or have certain weight goals or endurance sports tend to be at higher risk. So think things like distance running, swimming, cycling, figure skating, wrestling, rowing. These can be some sports that tend to be at higher risk. However, I think it's really important to note that any sport can be at risk. If you're not getting enough to meet your training demands, that you would be at risk. Also, it's important to note that it's not only elite athletes that end up with red S. We're talking high school athletes, recreational athletes, someone training for a marathon, someone training for a triathlon. All of these populations can be at risk for red S. So, an important question is weight loss or disordered eating always involved in red S? The short answer no. And that's a really common misconception, an important misconception. While disordered and eating disorders have a higher risk of red S, that they're not always necessarily present. An athlete can develop red S simply because the training volume increases and the nutrition doesn't keep up. Sometimes athletes feel like they're eating a lot, but their energy needs are just higher than they realize. Also, weight loss doesn't always occur. Sometimes athletes maintain a stable weight and will experience red S because the body adapts metabolically, even when the energy is low. So, can male athletes develop red S? The answer is yes, absolutely. Red S affects all genders. In the past, there was a lot of attention that was focused on the female athlete triad because menstrual changes were easier to observe as a sign of something that was wrong. But we now know that male athletes can experience similar physiological consequences of low energy availability. It just looks different. For example, they might experience reduced testosterone, decreased bone density, fatigue, increased risk for injury. Because there's not always that marker like a menstrual cycle, red S can sometimes be harder to identify in males, which is why education is so important. So hypothalamic amenorrhea is when menstrual cycles stop due to low energy availability, stress, or high training loads. When the brain senses that the body doesn't have enough energy available, it may reduce production of hormones. This can lead to irregular periods or complete absence of periods. Menstrual cycles matter because they're an important indicator of our overall health and energy balance. So when cycles stop, it can signal that the body may not be getting enough fuel to support hormone function. Long term effects can be bone health, cardiovascular health, and overall recovery. So there is not one single test for RED-S. Instead, it's usually identified by looking at a combination of symptoms, medical history, training load, nutrition intake. Usually, it's addressed in a team approach. Healthcare providers might look for certain signs like frequent injuries, stress fractures, fatigue, decreased the performance, irregular or missed menstrual cycles, change in mood or concentration, low bone density. So, some early and subtle warning signs of Red S that are easy to overlook might look like persistent fatigue, trouble recovering between sessions, feeling cold often, frequent injuries, nagging aches, irritability or low mood, changes in menstrual cycle. It can be sometimes easy to notice declining performance before they realize anything's going on, or that there might be an underlying fuel issue. Even though athletes might believe eating less could improve performance, the opposite is actually true. When energy availability becomes too low, athletes can experience things like slower recovery, reduced endurance, frequent injury risk, reduced strength, difficulty maintaining intensity. In the long term, proper fueling, eating adequately, supports better performance consistency and longevity in the sport. The good news is that Red S can be treated and it can be reversed. This might look like eating adequately, making sure that you're getting consistent meals and snacks. It might look like addressing training or changing up training a little bit and addressing disordered eating patterns if those are coming up. It's going to look different from individual to individual and how long it might take, especially for things like bone health and hormone health. However, once properly fueled and consistently fueled, some positive changes in reverse should happen. If there's one message that I want athletes to understand about Red S, it's that when our body is fueled adequately and properly, we are more likely to be able to do the things that we want to do in our sport, in our lives, and to be able to participate in these sports for as long as possible and probably the best as possible. And that our body is going to be able to adapt and to do the things that it needs to do in order to be the best possible athlete.